You just never know when you might need a doctor. You know, it seems the kids always get sick overnight.
Yeah.
What's with that? Or suddenly you step wrong and you sprain or break an ankle.
Ouch, stitches, coughing, headaches, the list goes on and on. And you may be wondering, do I need to go to the emergency room or to urgent care? And sometimes it's not clear which place you might need.
Okay, so to answer some of these questions, News 6 morning anchor and a health reporter, Kirsten O'Connor, is here to ask a doctor to help us clarify.
And I love hearing the ladies talk about that because I know every single one of them has been through this. A situation or illness becomes serious enough to seek attention right away, and you're not sure if you should go to the emergency room or urgent care. And you don't want to take up too much time to make your mind, so let's get serious. Nobody wants to pay a bunch of money either at the ER when they are not supposed to be there. So we brought in Dr. Lata Ganti to talk about the differences between the ER and urgent care. And there's also a freestanding type of option. So let's talk about the options to begin with.
Okay, so if you have an emergency, and you know how these things are, you never know when something is going to happen. You can either go to an urgent care, a freestanding emergency department, or a full hospital emergency department. The differences are, for example, urgent care usually tends to be open during business hours. So if it's after hours, most of the time you're looking at either a freestanding or a hospital ED. Urgent care is often staffed by mid-level providers, so you may have a nurse practitioner, you may have a physician assistant, and a physician overseeing, but the physician may not always be on site. Freestanding emergency departments, by contrast, are always staffed by at least one physician 24/7, so they're open all the time. And the difference between a freestanding and a regular hospital emergency department is it's truly freestanding, like it's actually a building
all
with
by
nothing
itself.
else attached, right, so freestanding. When would you decide to go to one or the other? It really depends on what is going on with you. So, for example, if you have like a minor cough, cold, scrape, something like that, you're probably easy to get into an urgent care in and out. Business hours, it's usually less expensive at an urgent care as well. Let's say it's after hours, urgent care is not open, you can go to a freestanding emergency department. The bill is definitely higher than an urgent care. Again, it all depends on insurance and location in the country and things like that, but that would be one of the deciding factors.
So let's say your child breaks their arm at school and it's in the middle of the day and you're just trying to figure out, okay, obviously they need emergency attention, but I don't know what's going to be the best for my insurance options. What would you recommend?
You could call ahead and see, who takes your insurance. Otherwise, I think an urgent care or freestanding are perfectly good options. Most of the time, they probably don't need a hospital emergency department. The key difference between a freestanding and a hospital emergency department is that if you need admission or surgery, then you really need to go to a full hospital emergency department. However, if you end up showing up at a freestanding, you can always be transferred to the hospital emergency department.
And with everything digital nowadays, I'm sure you can Google things.
You can actually go on your app, check in ahead of time, and get some idea of wait time as well.
That makes a huge difference. Now, we also talked about just having a general practitioner for these instances so that you can get right in with your doctor who already knows you. But like the ladies just mentioned, when things happen overnight, and that's usually when they do happen.
It seems like it always happens when the doctor's not available, right? Your own doctor. Always good to have a primary care physician. It's preventative. They know you. When you go to an urgent care or freestanding, usually they don't know you unless you go there a lot, I guess.
Right, and then you shouldn't be knowing them, but you do. What are some of the other things that you see when you go to an urgent care that are treatable? Like, I know one time I had to go for chest pain, and I was 25 years old and thought I shouldn't go to the emergency room because I'm too young for a serious emergency, but they sent me there.
Absolutely. So for evaluating chest pain, we usually do an electrocardiogram, we'll do some blood work. Even though you're right, 25 is not the age for heart attacks, they do happen, and so they do need to be evaluated in an emergency setting.
And it's because of the equipment, right?
The equipment, the personnel, the expertise, and if there's a need to hospitalize you as well.
Okay, so chest pain is one of them. Are there any other symptoms you should think about?
Anything that, like altered mental status, stroke-like symptoms that we've talked about, I think, before. Anything where you feel like you're definitely going to end up needing surgery, like an appendicitis. And of course, you may not know, right? How do you know if your belly pain is appendicitis? You may not know. But anything like that, I would definitely go to a full hospital emergency department. Also, if you have chronic problems or congenital problems where your case is a little more complicated than run-of-the-mill, probably you want to go to the hospital department that knows you.
All right, Dr. Lata Ganti with us again. Thank you so much. You always have the best answers. We appreciate you here on Ask a Doc. I'll send it back to the ladies at the desk.